Hey there. If you found your way here, I'm willing to bet you're looking for an answer. An answer to that nagging, persistent pain that just won't go away. Well, you are in exactly the right place. In this explainer, we are going to break down a really powerful technology that's offering brand new hope for people who feel stuck in that cycle of chronic pain. We'll dive into what it is, exactly how it works, and maybe, just maybe, help you figure out if it's the solution you've been looking for.
So here's our game plan. First up, we're going to talk about something you might know all too well, the chronic pain trap. Then, we'll introduce a way to literally reboot your body's healing system and get into the cool science behind it. After that, we'll walk you through what the treatment actually feels like step by step. We'll also cover which conditions see the best results, and finally, we'll tackle all those key questions so you can make a really informed decision. Ready? Let's get into it.
Okay, so before we can find the right solution, we have to really, truly understand the problem. Why on earth does some pain stick around for months, or even years? Let's unpack this frustrating cycle that keeps so many people from getting back to the lives they want to live. Tell me if this sounds familiar. You get an injury. You try resting it, you do the stretches, you go to physical therapy, you maybe even get a few massages, and yeah, you feel a little better for a while, but the second you try to get back to your normal activities, boom, the pain comes roaring right back. If you feel like you've tried everything under the sun without finding that lasting relief, you are not alone. This is an incredibly common and incredibly frustrating experience.
This chart right here shows exactly where things go off the rails. See, the problem isn't that you keep re-injuring yourself, it's that the original injury never finished healing in the first place. Your body's repair crew basically stalls out, especially in areas that don't get a lot of blood flow, like tendons. So instead of nice, healthy tissue, you end up with weak, disorganized scar tissue. And that degenerated tissue is what keeps screaming pain signals, trapping you in this vicious cycle.
I love this analogy because it's so perfect. After a while, your body just kind of gives up. The metabolic activity in that injured area slows way down. It stops sending the good stuff, the blood flow, the nutrients, the repair cells, because the emergency acute phase is long over. The engine of healing has completely stalled, and that tissue is just left there in this state of chronic disrepair. It's not getting worse, but it is definitely not getting any better. And that is precisely where shockwave therapy comes into the picture.
So, if the problem is a stalled healing engine, well, the solution has to be a jumpstart, right? What if you could send a powerful signal directly to that old stubborn injury, basically yelling at the body to get back to work and finish the job? That's the core idea we're about to dive into right now.
It's called radial pressure wave therapy, or RPW for short. And simply put, it's a non-invasive treatment. That means no needles, no surgery, and no pills. It uses powerful acoustic, or sound waves, to create a very specific response deep inside your tissues, and it has one main goal: to wake up your body's own natural healing systems that have pretty much gone to sleep.
Now let's just clear something up right off the bat because it's super important. The word shockwave, I get it, it sounds a little intimidating. But this therapy has absolutely positively nothing to do with electricity. You will not be shocked. It's a purely mechanical wave. It's a physical pulse of pressure that travels through your skin to the tissue. Honestly, think of it more like a really rapid and focused deep tissue pulse. That's a much better way to picture it.
Okay, so the science behind why this works is this amazing process with a big name, mechanotransduction. It sounds complicated, but the idea is simple. When that physical pressure wave hits the sleepy cells in your injured area, it's like flipping a light switch. That physical force triggers a chemical chain reaction inside the cell. This is the biological wake-up call that basically tells the cell, hey, get back to work. Start making new collagen, build new blood vessels, and let's get this repair process started again.
And here's the best way to think about it. Imagine your body's healing process is like a frozen computer program. It's just stuck on an error screen, not doing anything. Shockwave therapy is the Control-Alt-Delete. It's an intense, focused reboot designed to break that chronic, stuck cycle and get your body's natural operating system, its incredible ability to heal itself, working the way it's supposed to.
So we know it's a mechanical wave, and we know it reboots the healing process. But where did this come from, and what's really happening on a cellular level? Let's geek out for a minute and get into the science of how these pressure waves create real, lasting change in your body.
You know, the story here is actually a fantastic example of an accidental discovery in medicine. Back in the 80s, doctors were using these high-energy focused shockwaves to break up painful kidney stones without surgery, but they started noticing something really weird.
When the waves passed through the patient's hip bone on the way to the kidney, the bone in that area actually started to grow thicker and stronger. And that sparked a huge aha moment. Doctors thought, wait a minute, if it can stimulate bone growth, what else can it do? By the 90s, they were using it to heal bone fractures that wouldn't mend on their own, and, critically, for chronic tendon pain. Fast forward to today, and that technology has been refined into these compact, handheld devices that are a standard of care for all sorts of stubborn soft tissue injuries.
Now, it's really important to know there are two main flavors of this therapy. You've got focused shockwave, which concentrates all its energy on one single deep point, kind of like a laser beam. But the type we're talking about today is radial pressure wave therapy. With this kind, the energy is strongest right at the surface and then spreads out, almost like ripples in a pond. And this makes it absolutely perfect for the most common chronic conditions we see, things like plantar fasciitis, tennis elbow, and shoulder pain, where the damaged tissue is closer to the skin.
So what does that wake-up call actually tell the cells to do? Well, it kicks off 5 key healing actions all at once. First, it promotes angiogenesis. That's just a fancy word for building new blood vessels, which brings a fresh supply of oxygen and nutrients to a starved area. Next, it fires up collagen synthesis, telling the cells to build the strong, healthy fibers that make up tendons. It also calls in your body's own stem cells to the area to really supercharge the regeneration. On top of that, it helps calm down overstimulated nerve endings, which gives you pain relief. And finally, the physical force of the wave helps break up old, sticky scar tissue, clearing the way for new, healthy tissue to grow. It's a total, full-spectrum approach to healing.
To really picture what we're fixing, let's use a couple of simple analogies. Think of a tendon, like your Achilles or in your rotator cuff, as a strong rope that connects a muscle to a bone. Overuse can make that rope start to fray, and that's called tendinopathy. A ligament, on the other hand, is more like a rubber band that connects one bone to another, giving a joint stability. When you sprain your ankle, you overstretch that rubber band, creating tiny tears. Shockwave therapy works on both of these by telling the body to go in there and mend that frayed rope and repair the overstretched rubber band, making them strong and resilient once again.
All right, we've covered the science, so let's get really practical. What actually happens when you go in for a treatment? Knowing what to expect can make all the difference and take away any of that fear of the unknown. So let's just walk through a typical session together.
You know, a shockwave session is surprisingly quick and simple. First, your provider is going to do a careful assessment using their hands to find that exact precise point of maximum tenderness. This is so important, we want to hit the absolute epicenter of the problem. Second, they'll put some gel on your skin. It's the same kind of gel they use for an ultrasound, and it's essential because it makes sure every bit of that pressure wave energy gets into your body. Third, the treatment itself. The provider places the applicator right on that spot and delivers a set number of pulses, usually about 2,000, which only takes about 3 to 5 minutes. And finally, you'll get some very, very important but simple aftercare instructions to follow for the next couple of days. So what does it feel like? This is probably the #1 question everyone has. The absolute best description I've ever heard is the good hurt. Imagine someone giving you a very deep, intense massage right on the sore spots you have. It's definitely an uncomfortable sensation. You're going to feel it, but it shouldn't be sharp or unbearable. In fact, that discomfort is a great thing. It's feedback that tells both you and the provider that you're hitting the exact right tissue. Your provider will be talking to you the whole time to keep the intensity at a level that's therapeutic, but totally manageable.
Listen up, because what you do after the treatment is just as important as the treatment itself. You absolutely must avoid anti-inflammatory drugs like ibuprofen or Aleve. Why? Because Shockwave works by creating a pro-healing inflammatory response. Taking an anti-inflammatory is like putting out the fire that we just intentionally and carefully started. For that same reason, avoid icing the area. You also need to avoid any strenuous activity for about 48 hours. If you need some pain relief, Tylenol is okay, because it works in a different way and won't mess with the healing process we just kicked off.
All right, now let's talk about who this helps the most. Because while Shockwave is an amazing tool, it's not a silver bullet for every type of pain. It really shines in very specific situations, so let's get crystal clear on what those are.
So who is the absolute 100% perfect candidate for this therapy? It's someone who can check these 4 boxes. First, the pain is chronic. It's been hanging around for at least 3 months, but usually more like 6 months or longer. This is not for a brand new injury. Second, you've already tried the usual stuff, physical therapy, rest, stretching, and it just hasn't solved the problem. Third, your pain is localized. You can point with one finger and say, it hurts right here. And finally, that spot is in a superficial tissue, within that 3 to 4 centimeter range where the radial wave is most effective. If that sounds like you, then you are right in the sweet spot for this treatment. Let's start from the ground up. The foot and ankle are prime real estate for Shockwave.
For plantar fasciitis, it's one of the best treatments out there because it drives healing right into that tough tissue at the bottom of your foot. It's also a game changer for stubborn Achilles pain and peroneal tendinitis on the outside of the ankle. It can even help with nerve issues like Morton's neuroma by making the tissue around the nerve healthier.
Moving on up the leg, we see fantastic results for jumper's knee or patellar tendinopathy. A huge one is pain on the side of the hip. For years we called this bursitis, but now we know it's almost always a problem with the glute tendons right there. It's called greater trochanteric pain syndrome, and it responds beautifully to Shockwave. Same goes for that deep, nagging pain right where your hamstring attaches to your sit bone. That's proximal hamstring tendinopathy.
And for the upper body, those classic overuse injuries in the shoulder and elbow are treated all the time. This includes rotator cuff tendinopathy, where Shockwave can be especially helpful if you have calcium deposits, as the waves can help break those up. It's also great for biceps tendinitis right at the front of the shoulder. And of course the big ones, tennis elbow on the outside of the elbow and golfer's elbow on the inside.
Setting realistic expectations is everything, so it's so important to know what this fixes and what it doesn't. Shockwave is a powerhouse for chronic tendon issues, for scar tissue, for trigger points. It's a regenerative tool. But, and this is a big but, it is not a magic wand. It cannot reattach a completely torn tendon that needs surgery. It can't regrow cartilage in a joint that has severe bone-on-bone arthritis. And it should never, ever be used over things like active infections or tumors. It's a specific tool for a specific job.
Okay, in our final section, let's switch gears and tackle the practical, real-world questions that everybody has before they start a new treatment. The goal here is to give you all the information you need so you can walk into your doctor's office and have a confident, intelligent conversation and decide if this is the right move for you. This is a big one, and it's a totally fair question. If this treatment is so powerful, why can't I just get one and be done with it? The answer really gets to the core of how our bodies heal.
It's simple, really. You wouldn't go to the gym one time and expect to have bigger muscles the next day, right? Healing tissue is exactly the same. It's a cumulative process. The first session is the initial wake-up call. Every session after that builds on the last one. It's another signal, another stimulus to lay down more collagen, build more blood vessels, and make that tissue stronger. Real, lasting change takes repetition.
It's also really helpful to have a realistic timeline in your head. This isn't an overnight fix. After the first session or two, it's normal to just feel a bit sore, kind of like after a hard workout. Some people get a little relief, but many don't right away. The real change usually starts to happen around the third or fourth session. That's when people say, you know, it still hurts, but it's different. It's not as sharp. By sessions 5 and 6, you'll often notice better movement and longer periods where you feel pretty good. And in the later sessions, the goal is to see those pain episodes get shorter, weaker, and further apart, until hopefully they just fade away.
And now we have to talk about the practical, financial question that is, of course, on everyone's mind. Is my insurance going to pay for this? This is obviously a huge factor for most people when making healthcare decisions. The straight, honest answer is that right now, most insurance companies in the U.S. do not cover radial pressure wave therapy. Now, while that might sound like a negative, there's actually a pretty big upside. It means that your treatment plan is decided by you and your doctor, based purely on what is clinically best for you. There are no insurance pre-authorizations to wait for, no random limits on how many visits you can have, and no delays in getting the care you need. It puts you in the driver's seat of your own recovery. We have covered a ton of ground today. You now understand that chronic pain trap, how Shockwave can reboot your body's healing, and who it's designed to help. So the final step? Well, that's up to you. The whole point of this was to empower you, to give you the confidence to have a really good conversation with your provider. So go in and ask them, am I a good candidate for this? Based on my condition, what results can I realistically expect? And are there other therapies that would work well with this? Taking an active role is the single most powerful thing you can do on your path away from chronic pain. Thanks so much for joining me.